A diagnosis of a brain tumor typically means the start of months of treatments and invasive surgeries. But one Pine Bluff woman is the very first to try a new form of neurosurgery, allowing her to walk out of the hospital the very next day. Katrin Asaf is live in studio. And Katrin, this sounds pretty groundbreaking.
Well, Lauren, it absolutely is, and it actually involves technology that's already been around. The team at UAMS were the first to put these two pieces of tech together, making brain cancer treatment safer for a very special patient.
I thought it was a sinus pressure headache.
When Ashley James checked into an emergency room 2 years ago, she thought her splitting headache was just a cold. She had no clue of the real culprit.
I ended up having a kiwi-sized tumor in my right frontal lobe.
Glioblastoma multiforme, stage 4. In just hours, the 33-year-old mom was being scheduled for neurosurgery, a procedure her doctor said would take a few days to recover from.
They actually cut the skull open and he went in there with a scalpel and just cut the tumor out. My original surgery was October 23rd. I got out November 13th, so it was a very long 2 to 3 days.
The life-saving surgery had its side effects. Weakness on her left side she's still working through today.
I always tell people that I felt like the craniotomy was harder on me than the chemo and radiation.
So when her cancer came back 2 years later, this time with 2 more tumors, her team at UAMS knew they had to be careful. So they created something new.
These white areas, which basically is the program that we use to map out the highway systems of her brain.
Dr. Annalise Rodriguez is the first to use 2 programs to tackle Ashley's tumors, lasers to kill the cancer cells, and a new tool called QuickTome that maps networks in the brain.
We can map movement. We can also map language areas. This pathway is actually one of her attention networks.
Once in surgery, Dr. Rodriguez overlays the map with an MRI, making sure vital parts of the brain aren't touched by the heat. The result, a minimally invasive surgery where the results
I was actually home the next day.
Speak for themselves. Ashley hopes to continue that conversation, sharing this new tech.
Definitely excited about being able to bring new knowledge for other patients in my situation.
And keeping the fight going.
Now, Dr. Rodriguez says they hope to use this treatment with other patients depending on their case. As for Ashley, she'll continue chemo and radiation through the end of October. Reporting in studio, Katrin Asaf, Laura.